Okay, thank you very much, Roman, for that introduction, and thank you very much to the organisers for giving me, I think, the top spot in the session this afternoon. I'm first up. I'm going to be giving a presentation which is based on a piece of research which we have also published in a report. The report will be available from the marketplace. I think everybody has in their pack actually has a voucher which they can use to get that report. And obviously it's my report. I urge you to read it. But obviously there's a lot more detail in the report as well. There's also a sort of sister report to that, which is based on which is being presented on by my boss Jos Kleijnen in workshop number 2 on healthy ageing. And again, both those reports will be available in the workshop, in the marketplace. Okay, so my presentation: reflection process on chronic pain, prevalence, and cost. I'd also like to thank Grunenthal for their support for this piece of research, for paying for this research. I suppose I also ought to thank my colleagues back at Kleijnen Systematic Reviews, who I'm sure will be glued to their monitors, eating their popcorn right at this moment. Okay, where does this all begin? Well, I think, as you all know, and I've been hearing about throughout this symposium so far, in December 2010, the Council of European Union adopted innovative approaches for chronic diseases in public health and healthcare systems, which invited the European Commission and Member States to initiate a reflection process on chronic diseases stroke non-communicable diseases. And I've got a little bit of a delay on the presentation. Oh, here we go. The European Commissioner for Health and Consumer Policy, John Daly, stated on the 5th of May 2011, the Commission is well aware of the societal impact of chronic pain, which is often associated with underlying chronic diseases. This puts a burden on healthcare systems and on the economy. And hopefully what my presentation will offer is some insight into that burden or the impact of chronic pain. Of course, as been said, EFIC has highlighted that although acute pain may reasonably be considered a symptom of disease or injury, chronic and recurrent pain is a specific healthcare problem. I don't think my presentation is going to offer specific insight on the role of chronic pain as a disease, but certainly, hopefully, what it will highlight is the size of the problem. Okay, so what did we do? We did a systematic review of evidence to answer the questions: what is the impact of chronic pain as part of various other chronic diseases, and as a chronic disease by itself, as an entity in its own right, relative to other chronic diseases. We also looked at the response that there might have been from the EU itself and EU countries to the problem of chronic pain. And in this analysis, the impact of chronic pain is addressed in terms of prevalence, and here you see the euro coin, of course, in terms of cost. Chronic pain is common and costly and deserves higher prioritisation. Well, what did we find? The overall impact of pain measured in terms of prevalence and cost is high. Okay, and we'll come to some details in a moment. Chronic pain is most prevalent in those patients with other chronic diseases. But chronic pain can be considered as a very common and costly chronic disease in its own right. So if we do consider it as a disease, as a separate entity, we can see that it is common and it is costly. And I suppose, therefore, we would say that it is reasonable to conclude that chronic pain deserves higher prioritisation within the healthcare policies and budgets of EU member states, as well as at the EU level itself. So here's some of the data that we've looked at. Okay, prevalence within other chronic diseases. So if you look at this graph, you'll see on the vertical axis we've got percentage prevalence, the percentage of the population that actually has chronic pain. And in this case, in this particular slide, the labels on the horizontal axis are the different other chronic diseases that we're talking about. So within diabetes, for example, there's some evidence which says that over 30% of people with diabetes will suffer from chronic pain. You'll see also in the legend that the country is specified there. And there's one thing that perhaps needs to be pointed out even at this stage, and that is that there is not complete overlap between country, population and type of pain. There just hasn't been that much research done. Okay. But the prevalence within the general population can also be shown. And so if we look this time at this graph, we can see again percentage prevalence on the vertical axis again. But this time on the horizontal axis, we have the type of chronic pain rather than the population in which chronic pain occurs. This is now all within the general population. And what we can see is that these figures are, well, I guess, quite high. I draw your attention in particular to the label any, which is any kind of chronic pain, so regardless of type of pain. And you can see that although there's quite a lot of variation there, the minimum is about 16%, okay, which is that red bar, which is in the legend is shown as pertaining to Europe. But actually, there are studies that show that chronic pain could be much, much more prevalent. In fact, if we actually look at those figures, we can see that the prevalence of chronic pain in the general adult population in the studies that we found ranged from 16 to 46%. This is high in comparison to other chronic diseases, as shown in the latest EU Major Chronic Diseases report, which is a potentially fairly influential report, or has been an influential report within policy making in the EU. For example, the prevalence of dementia is no more than about 1.25% for depression, diabetes. We're talking about 4.5%, 7.8% respectively. Now, if you remember those figures, we're talking about a minimum of 16% for chronic pain, and possibly much higher. But it's also costly. Okay? And in the report, you'll find there's a lot more detail on the way in which chronic pain can impact, for example on days off work and lost productivity. But here, if we just look at costs, putting a euro value on these costs, this time on the vertical axis, we've got cost in euros, and this is the annual cost per individual. And then we've got different types of chronic pain and the countries where the studies were conducted. We've also got in the legend the type of cost, or the parts of the system where these costs are actually incurred. So it's a little bit complicated, this slide, but again, you can see that get a sort of an idea of the sort of size of the figures that we're talking about. Annual per person cost. Okay. If we just look at the average of the healthcare cost, which is in the sort of dark blue colour, we can see, depending on the country, depending on the type of pain, that it's somewhere, around sort of 1,400 euros or more, and rising possibly to over 2,000 euros. And again, if we look at the total public sector cost, which would be a composite of healthcare, social care costs, for example, then it could be extremely high. In particular, obviously, we can see Spain there, where it's over 8,000 euros per year. So the cost of chronic pain is high. Looking at the detail of these figures, the cost of healthcare per patient per year ranged from about 1,000 euros in Germany for back pain to over 3,000 euros for fibromyalgia in Spain. Social care cost and incapacity benefits payments were as high as 2,000 for fibromyalgia in Spain. And altogether, public sector costs per patient per year ranged for low back pain in Germany. I've just realised that I had checked my slides beforehand. In stretching the slides from 4x3 to 16x9, we've lost a couple of figures there. But we can see, again, that these figures could be quite high. But again, in comparison to other chronic diseases, How high are these figures? So what we did was we took the example of stroke, and this is a study that was conducted in 2009. All of these are what you would call cost of illness studies. So this is a cost of illness study in stroke, and the cost that came out in this study was, in the UK, a cost of about £9 billion per year in the UK. Okay, so that's a total population cost. What we were looking at before was per individual costs, okay? Now, this calculation was based on a prevalence estimate of about 2%, or about 1 million cases, which equates to a per individual amount of about 7,000 or UK pounds, or about 8,000 to 9,000 euros at the 2009 exchange rate. Okay, so thinking about those figures that we saw before, if we took a conservative estimate for low back pain of about 1,400 euros per year, and remember some of those figures were much, much higher than that, then applying a conservative estimate again for prevalence of, well, in this case I've chosen 15%, which is extremely conservative really if we look at those figures. A total annual population cost based on those figures will be about 10 billion euros in the UK. Okay? So we look at stroke and it's about 9 billion euros, and we've taken what we think are conservative estimates of cost and prevalence for chronic pain. We're looking at least that figure. So chronic pain must be a high priority. Well, that major and chronic diseases report, a quote from that is, cardiovascular disease, diabetes and mental illness are perceived to be dominant in mortality and morbidity. Okay, not chronic pain. Tackling chronic diseases in Europe, strategies, interventions and challenges, another potentially influential report. Chronic diseases are the leading cause of mortality and morbidity in Europe, and research suggests that complex conditions such as diabetes and depression will impose an even larger burden in the future. There's no mention of pain in the report, one single mention of musculoskeletal disease. Most of the report focuses on cardiovascular disease. However, there is evidence that the priority is improving, and some of that's already been mentioned, I've noticed today. One example is a report that's has been published in the Netherlands, Chronische Pain, published by an organisation responsible for quality of care in the Netherlands, where chronic pain is basically, highlighted, and the issues related to chronic pain, the fact that it hasn't been prioritised and that needs to be dealt with. And that's just come out. And also, I know what has been mentioned today is the Italian legislation, I think, which is from 2010, which has basically made getting pain care essentially a right within the legislation. And also, in 2011, the European Parliament adopted a resolution which basically highlighted the importance of the role of chronic pain. So what we would say, based on what we've seen in our review of the evidence on prevalence and cost, is that chronic pain is relevant to policymakers. Our report shows there is rich evidence for future policy making on chronic diseases, to include pain as an essential part of policy making, and to consider pain as a health state to be treated as a chronic disease on its own, in its own right. Okay? So we're not saying that's not my job, if you like, to say whether it should be a disease, but if that's the way in which it's considered, it would seem to be a very, very significant and important thing to be considered. EU policy documents do seem to show that whilst there has been a move led by EFIC to prioritise, and by others to prioritise chronic pain, that maybe member states and the European institutions have been a little bit slow to catch on, perhaps. So what we suggest is that policymakers include chronic pain and the role of chronic pain within their current and future reflection processes on chronic diseases. And hopefully the reports that we've published that you'll be able to get access to will be informative in your considerations of the role of chronic pain and how to deal with it. Thank you very much.
Thank you, Nigel.
Okay.
These are the two booklets. Yeah, I got them. Here are the 2 booklets you mentioned. You get the vouchers. Please stay here for questions. I'm not sure you may leave right now. No, it's too early. These are the booklets, and I promise you a lot of data. And I think it's especially useful if you use it versus press, versus media. For backup, for data, you can always rely on these booklets. And you get them for free at the marketplace where you get your coffee. Okay, questions to Nigel. Right here.
Yes. Is it working? Yeah. You've mentioned a lot of studies in different countries with a lot of different figures. Were they all using the same definition of chronic pain?
No, they weren't. I mean, that's one of the problems, really, with all of this research, is that what I've said already is that the measurement of prevalence, and the measurement of cost in particular, is done in lots of different ways. And there isn't a huge amount of research, there isn't a huge amount of coverage of all the different categories of costs. But obviously, I would say one of the most common aspects of the definition is that it's chronic, that it's pain lasting at least 3 months. But even that has its own sort of nuances. Is it just lasting 3 months? 3 months out of the last 6 months, and so on. There's a lot of variation in the definition of chronic pain.
It would be useful if we could also hear a definition of the word disease as used by the WHO this afternoon.
Okay, I'm sure somebody else might be able to help with that, maybe in one of the later presentations.
Professor Kress?
Yeah, I'm sure you will hear a definition at the latest when Professor Rief from Germany, who is negotiating with WHO about implementing chronic pain as a disease category in the ICD, will give his talk. And of course, that is a crucial point. But clearly speaking, I'm not interested in any semantics. And we are not talking about semantics. We are talking here about the possibility to make chronic pain visible. And only what is made visible is measurable. And we have seen a nice example of our dilemma. And that is that in this report you have presented of the European Commission, chronic pain does not appear. It does not exist. Why does it not exist? Because it's not existing in the categories of diseases. As long as this is the case, we have not to think about any political changes because they will not happen. Politicians do not change anything when there is no need. And something that doesn't exist in the official statistics will not urge them to react. So simple, I think we have to see this. And although I'm an academician, I'm academic, and I'm a scientist, nevertheless, this is not a case for sophisticated semantic discussions. We have to make a decision in favor of chronic disease. Otherwise, we have no chance.
May I add 2 questions according to this to Nigel? Question 1. Yeah. Would it change in any way some of your calculations whether it is a disease or not? And question 2, considering it would be defined as a disease of its own, could it change budget flows towards research and treatment?
Yeah, I think answering the first question is, I don't think it would change the results of the calculations as based on the data that has been obtained in those studies. However, what is probably true is that we might get better data collection, and that might change the calculations. I think we're still going to be looking at a sizable problem here, a sizable cost problem, but obviously in order to inform policy making as well as possible, we need accurate data. And if actually having chronic pain, which I think is coming to your second question, if having chronic pain defined as a disease helps that, then I'm certainly in favour of that from my position as a health economist.
Okay. Any further questions to Nigel? Okay, thanks very much. Oh, there is one. Sorry. She's so shy.
Well, I would like to go back to what I said earlier. So, what difference would it make, or would it actually give us better statistics if we had the underlying disease as one diagnosis, and the underlying disease plus pain as a separate disease? Then we would have both, and that would also show us statistics, give us statistics on how often a particular disease has significant pain as a comorbidity.
Yes, I mean, I think that potentially could be useful. I guess I'm not sure, and I'd need to think about it a little bit more. But as you know, our study was in kind of two parts, where we said, let's look at the impact of chronic pain as part of other chronic diseases. So to some extent, we did try to look at that. So where you can see that chronic pain is very prevalent generally, regardless of which other diseases you have. But it does seem to be particularly prevalent in some particular diseases as a comorbidity in a sense.
Okay, no, thank you.